I want to ask you something personal. Think back to 5 years ago. Could you walk to the end of your driveway, stand in the kitchen, and finish cooking a whole meal, or move through a grocery store without your legs slowing you down or complaining the whole time? Now think about today. For a lot of people watching this, something changed somewhere in between. The legs started feeling heavier, a little slower to warm up in the mornings. Maybe some tingling or that cold, disconnected feeling that wasn't there before. And if you've brought that up with your doctor, there's a real chance you heard something like, "That's pretty normal for your age." And look, that's not entirely wrong. Circulation does change as we get older. But here's what that answer often leaves out: why it changes as fast as it does for some people, and what role specific nutritional gaps play in how quickly and how noticeably that change happens. That's exactly what we're covering today. I'm Dr. Franklin, and over the next 18 minutes, I'm going to walk you through 5 vitamins that research has consistently linked to vascular health and leg circulation in older adults. We'll go in order from supporting players to most impactful. And the one at the very top of this list is the one that surprises people every single time. Stay with me because by the time we get there, you're going to want to have a pen nearby. But right now, before we go a second further, do me a quick favor. Drop a comment below and tell me your age and where you're watching from. I'll be referencing this as we go through the video, and it'll make everything much more personal and relevant. Before we get into the vitamins, I want to spend just a couple of minutes explaining what's actually happening inside your legs as you age. Because once you understand the mechanism, everything else we cover today will click into place much faster. Your legs are working harder than almost any other part of your body when it comes to circulation. Blood has to travel all the way down from your heart, navigate through progressively smaller vessels, deliver oxygen and nutrients to your muscles and nerves, and then fight gravity to make the return trip back up. The vessels doing that work have an inner lining called the endothelium. Think of it like the smooth interior surface of a well-maintained pipe. When it's healthy, blood moves through cleanly and efficiently. When it becomes inflamed, stiffened, or gradually damaged over time, circulation becomes sluggish, your muscles get less oxygen, your nerves get less support, and you feel it in every step. Over time, a few things work against that lining in older adults. Oxidative stress accumulates. Vessels lose some of their natural elasticity. The nerve signals that regulate blood vessel tone can weaken. And for many people, specific vitamin levels quietly drop, sometimes without dramatic symptoms in the early stages, sometimes for years before the effect becomes noticeable enough to connect the dots. That connection between specific nutritional gaps and declining leg circulation is well documented in the scientific literature. And yet, it's something that often doesn't make it into a standard 15-minute clinic visit. That's the gap I want to fill today. Vitamin number 5, vitamin C, the foundation of vessel structure. Vitamin C tends to get reduced to immune support and cold prevention in most conversations. But for your blood vessels, it plays a role much deeper than that. Your blood vessel walls are structurally reinforced by collagen, and your body cannot synthesize collagen without vitamin C. When vitamin C is consistently low, collagen production drops, and vessel walls gradually lose flexibility. Research links low vitamin C with reduced vascular flexibility in older adults, especially in the lower limbs. The key point is consistency. Vitamin C levels don't last long in the body, so steady intake matters more than large single doses. Vitamin number 4, vitamin E, the antioxidant shield for your vessel walls. Your blood vessels face oxidative stress daily from free radicals. Vitamin E helps protect cell membranes from this damage because it is fat-soluble and integrates into vessel walls. Studies show associations between higher vitamin E status and better endothelial function. It works best in its natural mixed form, not single synthetic alpha-tocopherol, and it should be taken with dietary fat for proper absorption. Vitamin number 3, vitamin K2, the calcium traffic controller. Vitamin K2 helps prevent calcium from depositing in artery walls and instead directs it toward bones. It activates proteins that regulate where calcium goes in the body. Large population studies, including the Rotterdam study, found strong associations between higher K2 intake and lower arterial calcification and cardiovascular risk. Dietary sources are limited, so MK7 supplements are commonly used. Vitamin number 2, vitamin D3, the vascular activator. Vitamin D receptors exist in blood vessel walls and help regulate nitric oxide, which supports vessel relaxation and blood flow. Deficiency is common, especially in older adults, due to reduced skin production. D3 also works closely with K2. D3 increases calcium absorption, while K2 directs it properly. This balance is important for vascular health. Vitamin number 1, vitamin B12. This is one of the most impactful nutrients for circulation, especially in older adults. B12 affects red blood cell formation, nerve signaling, and homocysteine regulation. Low levels can lead to poor oxygen delivery, nerve issues like tingling or numbness, and impaired vessel function. Absorption often declines with age due to reduced stomach acid and intrinsic factor. That's why deficiency is common even with a good diet. B12 supports circulation through three major pathways: improving red blood cell quality, maintaining nerve-to-vessel communication, and reducing homocysteine levels that can damage blood vessels. Because of this multi-effect, correcting a deficiency can lead to noticeable improvements in energy, warmth in the legs, and walking comfort in some people. If you take one thing from all of this, it's that these vitamins work together, not separately. Vitamin C builds structure, vitamin E protects it, vitamin K2 prevents calcification, vitamin D3 supports vessel relaxation, and vitamin B12 supports oxygen delivery and nerve function. The practical step is simple. Don't try to fix everything at once. Pick one area that matches what you're experiencing and get it checked with your doctor. That's how real improvement starts, one system at a time, not all at once.